Just heard the noon bell ring here in Fort, so I think we will get rolling on the webinar. So hello and welcome to all the listeners out there. My name is Maggie Seiler. I'm an associate editor for Horde's Dairyman magazine, and I want to say a special thank you for joining us today for this webinar titled Treating Diarrhea in Dairy Calves. Horde's Dairyman, along with the University of Illinois, have been co-hosting these presentations since 2011. It certainly takes a team to produce these webinars, so we appreciate working with our webinar producer, Jim Baltz from the University of Illinois, and our Horde's Dairyman online media manager, Patty Hurchin. They do a lot of the behind-the-scenes things to pull these events together, and we are very thankful for them. My co-host today is the well-known and well-respected Mike Hutchins from the University of Illinois. Together, we have the pleasure of welcoming Dr. Geof Smith as our webinar presenter. Dr. Smith is a professor of ruminant medicine in the Department of Population Health and Pathobiology at North Carolina State University. His primary research interests lie in clinical medicine and calf health. So today he's going to share some of those insights he has, especially pertaining to calf diarrhea and treatment. If you're with us listening on the presentation live, you have access to a PDF document of the slides that you can print off if you'd like. That handout can be found by going to the GoToWebinar panel of your screen and looking down in the handouts section there. So this webinar is sponsored by TechMix. We're certainly thankful to them for their support of this program. That's all from me. Mike, I'll turn it over to you to further introduce our speaker and kickstart the webinar.
Well, very good, Maggie, and it's my personal and professional opportunity to introduce Dr. Geof Smith. Dr. Smith grew up in South Carolina and received his bachelor's degree from Clemson University in 1994. Then he became very smart and decided to come to the University of Illinois, where he got his master's and PhD and D.V.M degrees here in 1996 and 1998. He then remained at the University of Illinois for another 4 years when he completed an internship at the veterinary school and residency in ruminant internal medicine, along with his PhD. In 2002, Dr. Smith joined the faculty at North Carolina State University, and Maggie pretty well laid out what his job there. So, Dr. Smith, welcome back. This is your second time at Horde's Dairyman webinar, yes, and we'll let you have the program.
All right. Thanks a lot, Mike and Maggie, for the introduction. What I want to do for the next 45 minutes or so is talk about best practices for treating calves with diarrhea. So just kind of as an overview of what we're going to do today, I'm just going to spend 10 minutes talking about what diarrhea does to the calf, what things we need to be worried about when we're approaching treatment of calf diarrhea. I'm going to spend some time talking about oral electrolyte therapy, how to make sure you're using a good oral electrolyte on your farm. Then we'll talk about some common mistakes that I see commonly both producers making and veterinarians to some degree when approaching the treatment of calf diarrhea. So the theme of the day is going to be about how do we treat diarrhea, which is still by far the most common reason for death loss, both in beef and dairy calves. About almost 68% of dairy calves in the last USDA survey that died before weaning was because of diarrhea. So certainly if you're going to have treatment knowledge, if you're going to have protocols on your farm in place for treating anything to do with calves, diarrhea's got to be at the top of the list. So before we get into how do we treat diarrhea, it's kind of important to understand what diarrhea is doing to the calf. What are the things that I need to be focused on as I approach this treatment of this calf with diarrhea? As they start to scour, they certainly get dehydrated. I think most of us understand dehydration. They're losing fluids faster than they're taking it in, very similar to an athlete or, the women's soccer teams that were competing in France recently. They also get electrolyte abnormalities. Electrolytes are things like sodium, potassium, chloride. The body is losing this when you have the scours, when you have diarrhea. We need to make sure we're replacing those electrolytes during the treatment phase. One of the big things that happens in calves is they develop a metabolic acidosis. Now, that's a big word, but basically what that means is the pH of their blood starts to decrease from what it should be. Pretty much all mammals, whether you're a human, whether you're a dog, whether you're a calf, we very closely regulate or control what the pH of our blood is, and it should be between 7.35 and 7.45. As the calf starts to scour, the pH of the blood will drop. It'll go to 7.3 or 7.2. And you'll notice that calf looks depressed. Once it gets to 7.1, usually they won't want to stand up anymore. Once it goes to 7.0, they'll be laying on their side, and that's about the time where they start to die. So treating this acidosis or correcting the pH of the blood is one of the big things that we need to do when we're treating these calves with diarrhea. And then the last thing we need to talk about is negative energy balance. These calves don't have a lot of fat reserve. When they break with diarrhea, they oftentimes stop drinking their milk, and they can starve to death if we don't make sure we get energy back into them. So that'll lead it to our first poll question here.
Well, I'll read it very quickly for Geof so you can kind of keep on task here. What is the first treatment you give on your dairy when you notice the calf has diarrhea? And Dr. Smith has given us 5 choices: antibiotic, Banamine, or oral fluids. Number 3, Pepto-Bismol, or an oral electrolyte. So the polls are now open, and we're off and running, and we've got 40% of the vote in. And Maggie, do you want to vote on this? I know which one I would select.
I think that when it comes to diarrhea, the most important thing is getting those oral electrolytes into them early, getting them up and going, and some fluids into them because they're evacuating a good amount of fluids out the back end, if you will. So correct me if I'm wrong.
Well, sounds good. Let's go ahead and share, Jim. We've got 70% of the vote in. So, Dr. Smith, what do you think of the survey results?
So 86% of people said their first treatment of choice is oral electrolytes, which, again, I agree with Maggie, would be what I would choose. And we'll kind of talk about why that is as we go through the rest of the poll. 8% of people said the first thing they do is give an antibiotic. And we're not really going to focus on antibiotics and calf diarrhea today. But if you think about the things I just talked about, these calves are getting dehydrated. They're developing an acidosis. They're losing energy. They're losing electrolytes. None of that is fixable with antibiotics. If you think about really the key problems associated with diarrhea, they are things that we would fix with oral electrolytes or potentially intravenous fluids, probably not antibiotics. So that's kind of the key principle of that question. So if you think about diarrhea, you don't really die from diarrhea. Think about people with Crohn's disease or inflammatory bowel disease. There's people that have diarrhea for years. You die from the metabolic consequences associated with diarrhea. Diarrhea itself is not that evil. However, we said earlier that at least 65% of the calves that died prior to weaning in the U.S. are dying from diarrhea. So clearly we are losing calves from scours. Why are they dying? We talked about this metabolic acidosis, and that's probably the main reason most of these calves are dying is the pH of their blood goes down to the point where they can't sustain life anymore. Some of these calves will develop bacterial infections in the blood. Some of them will starve to death. Some of them get really cold. So there's other potential reasons. But as long as we deal with the metabolic consequences of calf diarrhea, a lot of times we can get calves through this. You know, prevention of diarrhea is kind of a different talk. But if we focus on calves are getting diarrhea on my farm, how do I make sure that they're living? Really, oral electrolytes is probably the best thing we can do for them. Okay. So dehydration, obviously they're losing fluids out the back end. A lot of these calves are not drinking a lot of water during the first couple weeks of life. So when they start scouring, they go off milk. Remember, milk is 87% water. They're getting most of their fluid volume by drinking their milk. So when they stop drinking milk and they start having diarrhea real bad, they can get dehydrated in a hurry. And this is an emergency. So when these calves get diarrhea, we need to be very aggressive in terms of replacing fluids. Here you can see, this is not, I don't know what time zone everybody is in, but this is right here in North Carolina. We're right after lunch, and this is not a great after lunch picture, but you can see how much fluid these calves can lose in a very, very short period of time. One of the things that I like to talk with dairymen about is making sure you know how to assess dehydration. If I have a calf that I think might have diarrhea, how do I know is it dehydrated or not, or how severely is it dehydrated? And probably the best way to do that is to look at its eyeball position, okay? So if you have a dog, you take a dog to the vet, they may look at its gums, they may do some other tests to assess dehydration. But studies have shown that by far the best way in calves to tell if they're dehydrated or not is by look at the eyes. What do I mean by that? So here you see a calf where the eyeball is right up against the bottom eyelid. If I take my thumb and roll the eyelid down, I should not see a space or gap between the eyelid and the eyeball. That's a calf that has a normal hydration status. Here we see another calf where if you look at the eyeball, it's touching the eyelid. No space or gap there. That's normal. That's what these calves should look like. Here we see a calf where when I roll the bottom eyelid down, I see a significant space now between the eyelid and the eyeball. And what you'll notice is if you were to measure that, the bigger that space gets, the greater the percent dehydration that calf has. Now, I'm not suggesting everybody needs to start measuring the eyeball recession in their calves on their farm, but if you'll train your feeders to start looking at the eyes, you can quickly pick up this calf has mild dehydration, this calf has moderate, or this calf has very severe dehydration. Okay, so again, this chart will be something you can print off, but you know, less than 6% dehydration, we probably don't pick up. Those calves will look clinically normal. Their eyes aren't very sunken. 6 to 8% dehydration we would consider pretty mild. You'll have a little bit of sunkenness, if you will, of the eye. 8 to 10% is moderate. Eyes are a little bit more sunken. And then certainly, like the calf we saw in the last picture with very sunken eyes, that would be considered very severe dehydration. So one of the things we'll talk about at the end of the presentation is making sure that we recognize calves with diarrhea early. And this is another tool that we can use to make sure that we're picking up these calves before they start to go off feed. Another big thing we've talked about already is metabolic acidosis. You know, how do I know whether my calf has an acidosis? How do I know how aggressive I need to be here? Unfortunately, it's not as easy as just looking at eyeball position. There's nothing really on physical exam that will correlate with how low the pH of the blood is or how severe the acidosis is. The one thing that does correlate to some degree, at least in most cases, is how depressed the calf is. When the pH of the blood starts decreasing below normal, that calf will stumble around. It'll kind of look like it was out on the town last night drinking. It'll eventually lose its suckle reflex, and it'll go down. Acidosis causes direct depression of the central nervous system or the brain. So typically we use what we call depression scores because we don't always have access to running lab work on every calf. I mean, I have portable blood gas machines where I can do that on the farm, but it's still, I mean, it costs me $25 to do a blood gas on the calf. So it's not economical, even for a veterinarian, much less a producer, to start doing lab work on every calf that gets sick. So what we use typically is called depression scores, which means the sicker the calf looks, the more severe I'm going to assume that the acidosis, or the lower I'm going to assume its blood pH is, okay? We look at this calf. If I go to the farm and I see this calf laying on its side, it's clearly got diarrhea, it can't lift its head, it has no suckle reflex, I'm going to assume it has a pretty severe acidosis. This is a calf I probably would need to treat with intravenous fluids. Now, realize that depression scores are only a guide, and I might be wrong sometimes. If this calf is really cold, if it lives in Illinois and has hypothermia, if this calf is septic because it has a bacterial infection of the blood, there are other things that may cause me to think, well, the acidosis is more severe than it really is. But without the ability to routinely do lab work, depression score is pretty much what we use. So how we translate that, again, in the charts, if the calf is still on its feet, even if it's slow, it's drinking its milk very slowly, that leads me to believe that its acidosis is mild or not present. It probably has a fairly normal blood pH. Those are calves where if I get them on oral electrolytes right away, they should get better. Once the calf is down, if it'll sit up, if it'll hold its head up, if it still has a suckle reflex, you're kind of on the borderline. Those are calves. Some of those calves will respond still to oral electrolytes. Some of them probably need intravenous fluids. And then certainly like the calf we saw in the last picture, that calf is what I would call lateral recumbency, meaning it's lying on its side. It can't even sit up straight. Those are calves that are not going to respond very well to oral electrolytes. Those are calves that if you want to live, they're probably going to need intravenous fluids. Okay, electrolyte abnormalities. Again, I don't want to spend too much time on this, but in general, these calves are losing sodium in the manure. They're losing potassium. They're losing chloride. We need to make sure we're replacing that when we're treating calves with diarrhea. Okay. Again, negative energy balance. These calves don't have a lot of fat storage. They can starve to death in a hurry. So we need to make sure that we're doing something when we're treating diarrhea to get energy back into these calves. So oral electrolytes, these have long been the hallmark for treating calves with diarrhea. Why? They're quick, they're easy to do, they're fairly cheap. Most of our better oral electrolytes in the U.S. are $2, $2.50 a dose. So I don't have to call the veterinarian to do this. I don't have to put an intravenous catheter in. As the producer, I can do this by myself. And as long as we do two things, they work pretty well. Okay, one of those two things is I need to make sure I choose a good quality oral electrolyte solution that's going to meet the principles of treatment we just talked about. So we talked about correcting dehydration. We talked about replacing electrolytes. We talked about the big thing is correcting that blood pH or that acidosis. As long as we have a good quality oral electrolyte, that will be able to do those things. The next thing we need to make sure we are doing is recognizing diarrhea fairly early on the farm. Okay. If our first sign of diarrhea is the calf doesn't drink its milk or the calf is down, you're probably too late to consistently be effective with oral electrolytes. If we recognize diarrhea early and aggressively get these calves on oral electrolytes, we should be okay with treatment most of the time. If you have a really nasty salmonella or something like that, we may have to do more. But with our typical rotavirus cryptosporidial diarrhea, they will be responsive to oral electrolytes. Okay. I think some producers and even some veterinarians sort of think that, you know, Gatorade, Powerade, vitamin water, one oral electrolyte is just as good as another. These are just electrolytes that I dump in water. But we really do need to put some thought into which product that we're choosing and recommending for use on dairies. They're definitely not equal in terms of how well they're going to work for your farm. Many oral electrolytes are based on World Health Organizations for electrolytes in children, which brings us to the question, you know, are children and calves the same? If I have a calf with diarrhea, does it have the same challenges or the same problems as a child would? And the question is to some degree, but not always.
Well, Geof, we'll get... Yeah, very good. I'm sorry. This brings us to our second question here. And how do you choose an oral electrolyte that you use for calf scours on your dairy farm? And Dr. Smith has given us 5 choices. Number 1, I choose a product based on advertisement or sales rep. Number 2, the cheapest one I can find. Number 3, recommended by a neighbor or other dairyman. Number 4, recommended by the veterinarian. Or number 5, same one we've always used. So those are 5 choices here. Maggie, you're under the gun again. Which one are you going to select?
Sure, I think there's a couple that can kind of apply here. I guess for me, the important part, like Dr. Smith mentioned, is kind of what is the science behind it and what does that look like? I think, you know, you can get that information from a sales rep or from a neighbor, but I would probably start with the recommendation of my veterinarian, perhaps, and move from there based on which ones work best on my farm.
Well, I tell you, the Democrats are really slow again today. I have no idea. We're not going to wait for them, though. Jim, let's go ahead and share. We got over 60% of the vote in. And Dr. Smith, what do you think of the answers you see in front of you?
I like the answer. I'm not sure it's always correct. 71% of people said they choose an oral electrolyte based on recommendation by veterinarian. When I visit farms, it seems like I choose the same one we've always had, which got 10% of the vote. Seems very common. 7% of the vote was recommended by neighbor or another dairyman, which seems very common on the farms I go to. 10% says they choose the product based on an advertisement. I like that 71% of people say they listen to their veterinarian. I'm not sure I see those results quite as often as in the field. I see a lot of oral electrolytes that I think are not as effective that are being used. And when I ask people why, they've never really put any thought into it. They just assumed one product was as good as another. So what I want to do now is talk about, some ideal properties. We're slowly going to move through and hopefully give you some ammo to go choose an oral electrolyte. Really think about which one you're using on your farm. Is that the right one? Again, strike up a conversation with your veterinarian next time they're coming out to do herd check and say, hey, we use this product. What do you think of it? And they may or may not have an opinion, but we certainly can talk to them and make sure they have an opinion by the time they're done. But if I were making the ideal oral electrolyte that I was going to use in a calf, these are the things that I would be looking for, okay? Number one, it's got to have enough sodium to correct the dehydration. You don't really correct dehydration just with water, right? Athletes are not just drinking water during the game, they're drinking electrolytes like Gatorade. We need to make sure that sodium is in there in appropriate concentrations. Otherwise, we're really not effectively going to rehydrate those calves. The next thing we need to do is make sure there's some ingredient in my electrolyte that's going to help the intestine absorb sodium. Sodium can't just swim across the gut wall. It has to be carried across. And there's a couple different pathways to make sure that sodium will get absorbed across the gut. And we'll talk about that a little bit more. We've said a couple of times already that this decrease in blood pH was important, okay? That we said it's very common in calves that begin to have diarrhea. So we need to make sure we provide an alkalinizing agent. What does that mean? We need to put something in the electrolyte that's going to increase the pH of this blood. So if it drops from 7.4 to 7.2, I need something in there that will make sure the blood pH goes back up to normal. Those are things like acetate or propionate or bicarbonate. Okay. Need to make sure there's some energy in there if I'm going to use that. And particularly if you're withholding milk for any length of time, which we'll talk about here towards the end. And then lastly, I want to make sure that my oral electrolyte certainly isn't doing anything to encourage diarrhea, to make sure I'm facilitating that healthy gastrointestinal environment. Okay. In a little bit more detail now, sodium is the backbone of the extracellular fluid. What does that mean? That means you're not going to rehydrate a person, a calf, a foal, whatever has diarrhea unless you give it sodium. Lots of different studies have shown that the optimal sodium concentration to rehydrate calves is somewhere between 90 and 130 millimoles per liter. Now, milk has very low sodium. The concentration of sodium in milk is like 20 or 25. That's why if we just feed the calf milk, you're not really going to adequately rehydrate them. There are products on the market that have sodium concentrations of 40. So that's better than milk, but it's not where it needs to be to really adequately rehydrate these calves. So one of the things that we need to make sure when we look at our oral electrolyte, does it have enough sodium? Okay, is it optimally going to rehydrate this calf? Next thing, there's potassium and chloride ranges. You guys can look at those. What I will tell you is potassium chloride is probably the cheapest ingredient in your oral electrolyte. That's almost every product I know of in this country is probably going to meet those recommendations. The potassium and chloride levels are not something that you're probably going to use to determine which product I'm going to use on my farm. Again, sodium. Sodium is important. Sodium needs to be carried across the wall of the intestine to get absorbed into the blood, okay? One of the pathways that will help carry sodium is glucose, and many of our oral electrolytes have glucose in them. But typically we want either a neutral amino acid like glycine, or we want a volatile fatty acid like acetate, sometimes both. And those are also pathways that help facilitate sodium absorption in the intestine of these calves. Okay, so if you look at the label of your oral electrolyte, you might see sodium, but if you don't see glycine or acetate, you might have sufficient sodium in there, but if the calf doesn't have any way to absorb the sodium, it's not going to be very helpful to the calf. So you want to make sure you see glycine on the ingredient list. And again, that's an amino acid. Most of your better oral electrolytes will have glycine. I will say that's one of the more expensive ingredients. So a lot of the cheaper products will cut out the glycine. If you have something that's $1.50 a bag, they probably cut out the glycine because glycine isn't cheap. But if you cut out the glycine, even if you have enough sodium, it's probably not going to be very usable by the calf. Osmolality. Osmolality basically just refers to how concentrated, how much powder they put into the oral electrolyte once it gets dissolved in water. Okay, the easiest way, if you're not familiar with the concept of osmolality, to think about this is if I have a glass of tap water, then I take a glass of water from the ocean. Obviously, the ocean water is going to have higher osmolality. It's got salt, it's got other chemicals dissolved in it, okay, versus the tap water. So osmolality usually just refers to how much stuff is dissolved in your oral electrolyte. There are some of these products that are isotonic, meaning very similar to blood, very similar to milk, 280, 300 milliosmoles per liter. There are some of these that are very, very hypertonic, 750, 800 milliosmoles per liter. And in general, the higher the osmolality, the more sugar, the more dextrose they put in there. So when you look at your high energy oral electrolytes, they're going to be more hypertonic. They're going to have put more dextrose in there. Now, we already said these calves were in a state of negative energy balance. They were in danger of starving. So at least on the surface, it seems that more sugar would be good, right? These calves need energy. The problem is, as we crank up the osmolality too much, we run the risk of having more severe scours, and we also run the risk of having abomasal bloat. Okay? So my recommendation is to avoid anything above about 500 to 600. Okay? If you have solutions that are much higher than that, I think we have a greater risk of intestinal and abomasal diseases. It's okay to use things that are 400, 450, 500. Let's get some energy into those calves, but stay away from the products that are really, really high in osmolality. One of the big reasons I say that is because of abomasal bloat. Okay, so here's a calf that has abomasal bloat. We see this commonly in calves that are 10 days, 14 days of age. They go off feed. And this is, again, this is not rumen bloat like we see in cows. These are calves that have abomasal bloat. And part of the reason that we see this is, Clostridial bacteria get blamed for this a long time, but I'm convinced that this is primarily a nutritional disease, and the farm is doing something that is prolonging the emptying time of that stomach or that abomasum. The two biggest things we do that control abomasal emptying is the volume that we administer per feeding. So if you think about Thanksgiving, for those of us that have that holiday, you eat a big meal in the middle of the day, and at night you're not very hungry because a lot of that food is still sitting there. The larger the meal you eat, the longer it's going to sit in your stomach. The other big thing that controls emptying time is osmolality or calorie content. Okay, so here's a study where they fed two different oral electrolyte solutions, which were basically the same, except one had more sugar than the other. Calves got fed, you see this product on the top row, 360 milliosmoles per liter. It had some dextrose in it. And this study, that was completely emptied from the stomach in about 80 minutes. The same calves, a couple days later, they got a much higher osmolality product, 717 milliosmoles per liter, which had a lot more sugar in it. And that stayed in the stomach for about 4 to 5 hours. So as we start to increase osmolality on some of these solutions, we can start to have some health that's detrimental to the calf. That's why, remember when we talked about our ideal properties of oral electrolytes, that facilitating a healthy gastrointestinal environment, not doing anything that's going to make my GI disease worse than it already is. We may be doing that with some of these very high osmolality oral electrolytes. So again, more sugar is better. We need energy in the calves, but there is a limit in how much we can be pushing into these calves at one time and really get away with without producing some other problems as well. Alkalinizing agents. We've talked about metabolic acidosis, decreasing the pH of the blood quite a bit already. We've already said that's probably the leading reason why these calves die. So certainly something that we need to be cognizant of, and we need to be very aggressive when we're treating these calves with diarrhea. The two biggest alkalinizing agents we run into is bicarbonate and acetate. Propionate is out there to some degree and would be considered an alkalinizing agent as well. And these are things that are in oral electrolytes that are designed to increase the pH of the blood. Okay. In the U.S., we primarily have bicarbonate-based products, although there are several new acetate-based products that are out there now. In Europe, they've primarily been using acetate propionate-based products for a number of years now. They're widely available. Even the Canadians actually probably have 5 or 10 acetate propionate-based compounds out there. We've been using bicarb in the U.S. here for a long time, and while bicarbonate is effective and it works, unfortunately, I think the acetate propionate-based products do have several advantages. One of the advantages we've already talked about. Remember, we said acetate was one of the ways whereby we could help with sodium absorption in the intestine. So if I have acetate in there, that's also going to help with my sodium absorption. Okay, so that's one potential advantage. Another advantage is acetate actually can be used as an energy source by the calf, whereas bicarbonate really doesn't have any energy value. Another thing that we've done some research on, I don't want to spend time here talking about it today, but when we feed bicarbonate-based oral electrolytes, particularly if we're doing it day after day after day, what you're going to see is an increase in the pH of the stomach of the calf. And that really can promote bacterial growth. More of the bacteria that are in the stomach can reach the small intestine. We see an alkalinization of the stomach, or the abomasum, if you will, and we don't see that with acetate-based products. So again, I'm not saying bicarbonate-based products are evil, but there are some disadvantages of them as compared to acetate. If I had a choice of using an acetate and or propionate-based oral electrolyte over a bicarbonate-based one, I probably would choose that. Okay. Psyllium. Psyllium is metamucil. Psyllium is fiber. Psyllium is what's in our gelling oral electrolytes. Okay. So the theory behind psyllium is that it's going to thicken the oral electrolyte. It's going to take longer to flow through the system, and the calf will be able to absorb more of the nutrients that's in the oral electrolyte as compared to products that don't have psyllium. And again, a lot of your gelling oral electrolytes have some type of a fiber or psyllium in them. Unfortunately, when we've done research, psyllium doesn't really work. Okay, so here you see two different oral electrolytes. They're basically the same thing, except one has psyllium and one does not. And what you can see here is blood sugar concentrations, plasma glucose. So obviously, if psyllium was doing its thing, this red line here would be the psyllium product. I have consistently higher blood glucose results than I do with the blue product. Unfortunately, this is a psyllium one, and this is without psyllium. Every time these studies are done, psyllium seems to hinder absorption of sodium, of glucose, of things like that from the oral electrolyte. So some of the producers like the gelling oral electrolytes. They sort of thickens the manure. They perceive the calf maybe getting a little bit better, but metabolically, that calf is not doing as well. So, one of the big lessons from today is you can't judge how the calf is doing by what the manure looks like. If you don't want to see any manure at all, just stop feeding the calf. It'll starve to death, but you won't have to look at scours anymore. We need to look at how the calf is doing. What's its attitude like? What do his eyes look like? Not just the manure. But stay away from your gelling oral electrolytes. They're not going to perform as well as the ones that don't have psyllium in them. So again, I don't want to spend a lot of time getting into certain products today. We have people from many countries. I'm not sure what products are available in all countries, but I want to give you an example of a product that is a very good oral electrolyte. It's available in the United States. It's available in several countries in Europe. I know they've launched it over there. Just to give a shout out to our sponsor, TechMix, for the day. This is an example of a liquid oral electrolyte that can be used in calves and is very effective. Okay. So you see, based on what things we've talked about already, I said the sodium should be 90 to 130. This is 128. I gave you ranges for sodium and chloride. That will be within the range. It has glycine in there. That's an amino acid that will help absorb sodium in the gut. We have a moderate osmolality, 440. So you're getting some sugar out of this. You're getting some energy for the calf, but we're not going to really significantly prolong abomasal emptying. We're not going to significantly worsen the diarrhea by having a very high osmolality product go through the intestine. We have a combination of acetate and propionate for our alkalinizing agent, and we don't have psyllium. I did talk about strong ion difference, but here we have a product with a very good strong ion difference, meaning it has a very strong ability to alkalinize the calf or to increase the blood pH back to normal. So I'm not by any means saying this is the only product I would recommend in the U.S., but this is kind of an example of the information that I would be looking for if I was a veterinarian. And this is unfortunately not going to be on the label of most products. When you look, it'll have a percent sodium or how many grams of sodium, how many grams of potassium. This is information that you and your veterinarian are going to have to work to find on many of these products. Okay, and we can talk about how to do that later if you want. But this is the type of information you're going to want to know in terms of, is this a good oral electrolyte that I can use on my farm? Last poll question.
Yes, sir, Geof. You can take a quick break here. Do you withhold milk from calves on your farm when they have diarrhea? And now we only have 3 choices, so that'll help our Democrats a great deal. Number 1, no, we continue to let them have their full milk allotment. 2, partially, we reduce the amount of milk they're allowed. Or 3, yes, we stop milk for at least 1 or 2 days when the calf starts to scour. Okay, Maggie, you're under the gun now. This could be interesting. We'll see where you want to go on this one.
Absolutely. Well, I think it's certainly true that it's hard to get some of these scouring calves to be interested in consuming feed. But gosh, they, like Dr. Smith mentioned earlier, don't have a lot of nutrient stores, and it's pretty darn important to get that milk into their system. So my answer would be no, we continue to let them have their full milk allotment, or at least we do our very best to get as much into them as we can.
Wow, you're really on your game here today, girl. You must have been watching that soccer game. Anyway, let's close the poll. And Dr. Smith, what do you think of the answers?
Very good. 60% of people said we continue to let them have their full milk allotment, which is what I would choose, and we'll talk about why that is moving forward. 37% says we partially reduce the amount of milk they are allowed, and 5% actually said they stop milk completely for a day or 2. So let's talk about whether that's a good idea or not, okay? Before I get into that, I just want to mention oral electrolyte feeding. I had my poll question a slide or two too soon here. So how do I feed oral electrolytes? I usually try to feed them as an extra meal. If you're feeding milk twice a day, feed your oral electrolytes in the middle of the day. At least on the first day, if they're aggressively scouring, I may try to feed oral electrolytes twice if I can, but at least once a day, and probably continue oral electrolytes through the duration of diarrhea, okay? If possible, I always prefer to mix them in water and feed that way. A fairly simple question that I get asked a lot is, can I feed the electrolyte in milk? And that's actually a fairly complicated answer. It depends on which electrolyte you're using. It also depends on what your milk is. If you're feeding a bicarbonate-based oral electrolyte solution, it's recommended that you not add that to milk. Bicarbonate will interfere with digestion of milk, so we're supposed to separate by at least 2 hours when you're feeding bicarbonate-based oral electrolytes. If you're feeding an acetate-based product with a moderate osmolality, so 450 or less, and you're feeding whole milk or something with a pretty low osmolality, you could consider mixing those two together. Again, I would always prefer that it would be water, but if because of the labor situation, the third feeding is not going to happen and there has to be something mixed with milk, you're going to want to make sure that you're feeding whole milk or something with a fairly low osmolality, and you're going to want to make sure you're using an acetate-based oral electrolyte solution that doesn't interfere with milk digestion. There are 1 or 2 products in the U.S. that are even approved to be added to milk. So definitely using one of those products would be helpful. If you're using a 28% protein milk replacer, realize that probably already has an osmolality of 600 or 700. So if I take an oral electrolyte and put it in there, That's going to be very, very dangerous. So a very simple question, can I put oral electrolytes in milk, is actually a fairly complicated answer depending on what you're feeding on your farm, what your oral electrolyte is, and what your feeding schedule is. So if I haven't exactly answered your question, we can talk about it at the end, or I would encourage you to talk with your veterinarian about that feeding program and see what he or she recommends. So now back to milk. Should we rest the gut? And a lot of people, particularly those in Europe, have been big fans of withholding milk from calves for a couple of days once they start to scour. What people will say is there's faster resolution of the diarrhea if we pull milk. The gut is going to heal faster. Some people say the calf is not digesting the milk. I can smell it when it comes out. It's just passing through. I'm just feeding the viruses with nutrients. What I'll say is, those things make sense if you think about them, but none of that has ever been demonstrated, okay? There are several studies that have been done, including some at the University of Illinois, and no study that I'm aware of says diarrhea resolves faster if you withhold milk. I want to show you just one study. Again, we don't have time to go through a lot of data here, but this is a study that was done in Colorado. I show you this because it's fairly recent and it had a large number of calves. This is 360 calves with naturally occurring diarrhea. Any calf that needed IV fluids or that had a pneumonia or some other disease was kicked off. So these are just calves with diarrhea. 180 calves got one oral electrolyte product that, per the directions of that product, said, I called it oral electrolyte solution A, but you've got the name in there. So 2 feedings of the oral electrolyte product only for 2 days, so completely withhold milk, and then mix 1 liter of milk with 1 liter of oral electrolyte through day 4. The other 180 calves got a different oral electrolyte that's actually labeled to be given with milk. So they mixed a packet with 2 liters of milk twice a day for 2 days, and they continued that for a longer period if the calf continued to have diarrhea. So if we look at results from this study, again, this is in kilograms here, but weight at the start of the trial, no different. Weight gain 5 days after treatment. You can see these calves where we've continued to feed milk have gained about 6 pounds, whereas these other calves have only gained about 1 pound. Weight gain during treatment, again, 0.6 kilograms, or about 1 pound versus about 6 pounds, okay? Weaning weight, 15 pounds heavier if we continue to feed milk through the diarrhea phase. And time to resolution of diarrhea, actually significantly shorter by continuing to feed milk, okay? So, again, there's no data that I'm aware of anywhere in the world that says diarrhea resolves faster if we withhold milk from these calves. The other thing I get asked a lot is, do they need more than 1 feeding of oral electrolytes, or how many days do I feed oral electrolytes? You see from this data how long diarrhea lasts: 5 to 7, 8 days. Okay, diarrhea lasts for about a week. I would say that's probably about how long we need to keep these calves on oral electrolytes, a feeding a day through the diarrhea period or until it stops. So oral electrolytes, no matter which one we choose, they just don't have enough energy to sustain these calves. Therefore, they need milk. If they don't want milk, I certainly wouldn't say to tube feed them, get electrolytes in them. However you need to. You can skip a feeding if the calf is depressed and doesn't want to nurse. But I would hope that within 12 hours, if my treatment is working, that calf will want to drink some of it. Even if it drinks half the bottle, that's good. Probably small volumes of milk frequently is the best thing for these calves. Whether or not people have the labor situation to be able to feed sick calves differently than healthy calves is another issue. But I would hope by 12 to 24 hours, these calves will want to go back on milk. If they don't, they probably have a lower blood pH than you think they do. They may need some IV fluids or something like that. But I hope within a day that these calves will go back on milk voluntarily. So I'm not force feeding these calves, but I would never deliberately withhold milk from them if they're willing to drink it. This is treatment of diarrhea. This is from World Health Organization. This is treatment for severe diarrhea in children. If we look here, it says the infant's usual diet should be continued during diarrhea and increased afterwards. Food should never be withheld. The child's usual food should not be diluted. Children whose food is restricted lose weight have diarrhea of longer duration, and recover intestinal function more slowly. So we know across species that we should not withhold milk from animals, humans with diarrhea, but I consistently see producers that choose to do that. Again, they're mainly looking at the manure. They think they see milk coming out the other end. They say the calf is not digesting it. It's probably not digesting all of it, but it is getting some nutritive value out of the milk. So stop looking at the manure. If the calf wants to drink the milk, let them drink the milk. Okay. I'm not going to talk about intravenous fluids, but certainly there are times when these are required. When that calf is down, it's not responsive. We need to make sure we have a relationship with the veterinarian, or I have a protocol in place that my veterinarian has helped me with, and I know either how to do IV fluids or when to call a veterinarian to come do IV fluids. But there's certainly times where the calf is too sick for oral electrolytes. So last few slides here, problems that I see people making when they're treating diarrhea, not catching it soon enough. And we talked about this a little bit earlier, but if your first sign of diarrhea is the calf didn't drink its milk today, you're probably too late. Teach people what to recognize. You know, if you're housing calves on straw, it's easy to miss scours. It'll run right through the straw. So, you know, are they drinking their milk aggressively? How is their attitude? Do their eyes look good? You know, and if you're going through and they're really slow drinking the milk, maybe just put a clothespin on that hutch or that stall and come back and look at the calf later. But we need to make sure we're training our people how to recognize diarrhea early. If we can catch them early and get them on a good oral electrolyte, most of these calves will get better. Okay. Not giving enough fluids. I see a lot of people give 1 or 2 liters of IV or subcutaneous under the skin fluids to calves, and that just isn't enough. Remember, we said probably the minimum dehydration we could pick up was 6%. So if you have a 40-kilogram calf that's already 6% dehydrated, that calf needs 3 liters just to correct its existing deficit. Okay. So if you think you're giving a lot of fluids to a calf with a liter or 2, we're really not. We probably need 4 to 5 liters of fluids to really do much to these calves, which is certainly cheaper to do it orally. Okay. I had some data here which you guys can look at and email me if you have any questions about this, but we did a study comparing oral electrolytes to IV fluids to sub-Q fluids, and what we found is when we looked at ability to restore pH, oral electrolytes were better. Ability to restore plasma volume, oral electrolytes were very good. Fluids under the skin are very, very slow. Okay. This is blood glucose. Oral electrolytes were very good. So oral electrolytes a lot of times are seen as not very sexy. You know, a lot of people really enjoy having pallets of fluids on their farm, but oral electrolytes really are effective as long as they're used properly. Okay. Mistake number 3, giving oral fluids to a calf that needs IV fluids or not addressing the acidosis. Okay. When that calf is down, it has no suckle reflex. If you just tube feed it oral electrolytes, you're probably not going to have much benefit there. That fluid is just going to sit in the abomasum and not much is going to happen. That's when we get back to having that IV fluid therapy protocol with our veterinarian, or knowing when we need to call the veterinarian to come out. And then lastly, withholding milk for more than 24 hours. Again, those calves will starve to death. Diarrhea can go on for 5 to 7 days. If you think about your oral electrolyte, they're going to rehydrate the calf. They're going to correct the electrolytes. They're going to correct the acidosis. And getting them back on milk is what's going to get energy into that calf. So last slide here, if we think about our treatment diarrhea goals again, and this will go back to our first poll question, what are the things we're trying to do? We're trying to correct the dehydration. We're trying to replenish electrolytes. We're trying to correct that acidosis, that low pH. We're trying to provide nutritional support. None of those goals do I meet with antibiotics. Okay, antibiotics is something that I see a lot of producers use right away on these calves with diarrhea. And I'm certainly not going to tell you not to use antibiotics, but that's really not addressing the main problems that these calves have. We need to make sure that we're recognizing it early, using an effective oral electrolyte product on our farm, and getting that into these calves right away. So with that, I'm going to stop. 1:50 I was told, and I'm right on time. And we'll be happy to go to some questions now, Mike.
Well, we'll turn the program back over to Maggie for a few comments, since some of the people will probably be leaving us, and give you a little bit of a break to get a drink of water. Maggie, do you want to take us to the next one?
Absolutely. Thanks so much for that presentation, Dr. Smith. I'd like to remind all the listeners that our webinars are archived. And to date, our archives have been viewed more than 160,000 times. So if you'd like to view this webinar again or any of our previous webinars, you can visit our archives at any time at www.hordes.com/webinars. Also, you received an email survey. You will receive an email survey later this week. In that survey, you will have the opportunity to evaluate today's presenter and topic, and your feedback is appreciated as it helps us select topics and speakers for future webinars. We hope you'll make plans to attend our next webinar, which you can see the date and time there, on Monday, August 12th. The title of that presentation is Monitoring and Improving Cow Comfort in Free Stalls and Tie Stalls. It's presented by Cornell's Lindsay Ferlito. And the following one will be September 9th, sponsored by Cargill, and talking about fats in the dairy ration. So I think there's a lot of good pre-questions and a lot of questions that I've seen pop up in the tab during the presentation. So I'll pass it back over to you, Mike, to do a few of those.
Well, very good, Maggie. I think all our listeners are aware now that you can submit questions ahead, and Patty gets these categorized. So we have about 4 of them. So let's start off with them, Dr. Smith. So this is the feed. It's the speed round. Does feeding calves a high level of milk or milk replacer cause diarrhea? Specifically, 8 liters fed 2 meals a day. Will that cause diarrhea? I have a lot of workers that think that's the main cause of loose feces.
So the short answer is no. A little bit more detail would be that certainly as we feed calves greater volumes of milk, they're going to produce more manure. If you've changed the diaper of a baby, you realize it's not a formed manure. So certainly as you transition from feeding 4 liters to 6 liters to 8 liters a day, a lot of people perceive that those calves have diarrhea, and it is probably looser than you would typically see. But those calves typically are happy. They're running around. Their eyes look normal. That's not a diarrhea that I worry about. You know, if you have a heifer that's on fresh alfalfa, green chops, she's going to have pretty loose manure, but she's happy. So no, I wouldn't say that increased milk is causing diarrhea, although certainly you will see more manure than they've been used to, and it may be a little loose. It's not a pathologic diarrhea.
Our second question that came in for our listeners: are there any studies that have looked at 1 feeding colostrum versus 2 feeding colostrum and the effects of that on scour prevention?
I noticed several questions on kind of cause and prevention of diarrhea, which is a separate webinar in itself. Maybe if I didn't suck too bad, we can do that next year. But yes and no. There are studies that have looked at passive transfer, your level of antibody, and that will correlate with diarrhea. Obviously, the better job you do with the colostrum management, the lower your risk of diarrhea. There are studies that say 2 feedings versus 1 feeding, you can do a little bit better on what your antibody level is with 2 feedings than just 1. But I don't know of any studies that have directly looked at 1 versus 2 feedings and percent of calves that develop diarrhea after that. But you probably should be monitoring your total proteins. Make sure you're happy with where you are. I think one of the things that's not talked about a lot yet is our goal has probably historically been too low. We've had a goal of 5.5 for total protein in these calves, and there's some new data that will come out soon that says our goal probably should be 6 or maybe even 6.2 on total proteins. But the better we can do on increasing that, probably the lower the risk of our diarrhea will be.
Another question is, what might be some of the main reasons for early cases of diarrhea? I'm especially interested in those that might cause a high percentage of diarrhea cases in the first day of life.
By far, the most common cause of diarrhea in the first day or 2 of life are going to be enterotoxigenic E. coli. We don't see that a lot anymore because a lot of the scour vaccines that we give the cows are pretty good at preventing that. But if you're not using a scour vaccine and you're consistently seeing diarrhea in day 1, day 2, it's almost certainly E. coli. There are some other potential causes, but that would be by far the most common and the thing that I would try to rule out first.
Here's the other question that came in and over the weekend, and that is, are there resources that would contain a flow chart type instruction for handling of the treatment of diarrhea or other calfhood symptoms of illness, such as if the X appears, yes, go down this route, or if Y appears, no, go this other route?
You know, there are, but most of those things are private treatment protocols for farms. I would encourage you to develop a treatment protocol for your dairy, but I would probably not recommend that you pull one out of the back of Horde's magazine. I think that the goals of each farm should be fairly specific. What oral electrolyte you want to use? When do we want to think about antibiotics? Do I want to use something for pain relief? So I would say there are a lot of protocols, flow sheets available, but probably none that should just be readily adopted by each dairyman. I would encourage you to work with a vet or work with a specialist and come up with a chart that you think is best for your farm. I think the gentleman that submitted this question is from the Netherlands. And, you know, for me to give you a flow chart that I use here may be completely different than what you want to do there. So, you know, I would encourage you not to just pull one from the internet, but to really talk with your vet and see what should I be doing on my farm. You know, if their temperature's over 40, I want to use an antibiotic or things like that. Using one blanket flow chart is probably not a great idea.
Okay, here's another question you kind of set up. Can I look at a label of electrolyte and know the amount of sodium based on the guaranteed analysis from someone in Wisconsin?
Very difficult. Okay, some of the products will give it to you, and again, you want millimoles or milliequivalents per liter, but a lot of the time you're going to have to call the company. There are some papers out there that have tables with quite a few of the electrolytes. If you talk with your vet, they may be able to get you one of those. But I have a spreadsheet that was made for me by a chemist where sometimes I can calculate based on the information what's in there, but it's very difficult with the information they put on the label. Remember, these are not FDA approved products. These are just nutritional products. So they don't have to give you all that much information.
Very good. Here's one's a little different. What about goats? Should we be looking for in a product, and they specify Nigerian dwarf dairy goats, but it's probably goats in general?
To the best of my knowledge, for what we know about goats, the pathophysiology is very similar to calves. They do develop an acidosis. I would say my ideal or electrolyte recommendations, products that I think are good for a calf, would be similar to what I'd recommend for a goat. You know, we know less about goats than we do calves just because there's less research that has been done. But I would say, other than feeding a lower volume, everything else we said today would be true for Nigerian dwarf goats as well.
What about abomasal ulcers in young calves? Any comments on causes and treatments?
Consistency. I think a lot of the things we talked about for bloat, if we have erratic feeding schedules, if we're not mixing the milk replacer very well, you know, that's when we start to see bloat. I think the same thing exists for ulcers. I think the biggest thing for ulcers is stress, which has to do with inconsistencies in the calf's environment. I was working with a big calf ranch in Texas, and they had about 15% of their calves, the highest ulcer rate I've ever seen, and they were feeding a combination of white milk, chocolate milk, and orange juice that they were getting free from grocery stores or at greatly reduced cost. And obviously there was a lot of inconsistency in what they were feeding. Some days they added powder, some days they didn't. And when we were able to get them on a consistent milk and consistent feeding schedules, our ulcer rate went way down. Background disease, if you have diarrhea, if you have pneumonia, that will stress the calf, that will promote ulcers. But I think from a treatment standpoint is more of a management standpoint. Make sure we're doing everything correctly. We have a clean environment. We have a consistent milk product being delivered on a consistent schedule. That is probably my best way to reduce ulcers.
Another question is, what can be done when calves eat sand from beddings? Or I was on a farm in Mexico where the calves were bedded on sand and they just were eating too much sand. Why do they do that?
You know, that's a good question. And that also relates to the ulcer question. Ulcers have been related to sand. Ulcers have been related to hairballs. What we don't know is the sand causing the ulcer, or are they eating sand because the stomach hurts already from the ulcer? It's kind of a chicken or the egg. there's definitely a correlation between eating sand and hungry. So if you're on a farm where they're eating sand and they're feeding 2 quarts of milk in the morning and 2 quarts in the evening, I would say feed the calves more milk. Sometimes I think they eat sand out of boredom, but I don't know that we always have a reason why they eat sand. I used to think sand wasn't a big deal, but I've seen necropsy calves that were just full of sand, and I had to think it had something to do with it. But I don't know why they always eat sand. I'm not a great believer in sand bedding for calves, but I know it's an easy bedding in many areas. But other than feeding them more, I don't have a great way to get them off eating sand.
Okay. What do you recommend when salmonella is a problem in terms of drug treatment? Now, that kind of gets into another area, but that question came in.
That's really going to be dependent on what country you come from and the laws in that country. Here in the U.S., it's very difficult. Obviously, we need antibiotics that are going to kill salmonella. We don't have labeled drugs for salmonella. It's very difficult to find effective drugs that are legal. If you lived in a country where, like Mexico, you could use fluoroquinolone like a Baytril, that would be a reasonable choice. If you could use high doses of ceftiofur, that would be a reasonable choice. But again, that's going to be a deal where you want to talk to your veterinarian and decide what can we use legally, because the laws are very different from country to country. So it'd be very tough for me to give a blanket statement on an international webinar on what antibiotic to choose for salmonella.
Okay, you don't want to answer that one. We'll move on to, I'm just kidding. You're doing a great job. How do you treat diarrhea in a calf that is 1 or 2 days old who just received their colostrum? Any thoughts or strategies on that one?
Probably the same as we talked about. I'd get them on oral electrolytes. If they just got their colostrum, they may not want to drink milk again for 24 hours, 30 hours. So make sure I was keeping oral electrolytes in them until they came back on milk again. Again, if you're a day old, I would really look into enterotoxigenic E. coli quickly. And if that's what it is, there are pretty effective vaccine options. So there are options that I can use for the cow right before, as she goes dry. There's also options that I could use orally in the calf when it was born. So other than consistently treat those calves, what I probably would do pretty quickly is try to figure out what's causing it and get them on an appropriate vaccine until I have time to get the dry cow herd vaccinated. Even if go ahead.
No, go ahead. I'm sorry. I thought you were done.
Even if I say today I'm going to vaccinate the dry cows, it's going to be 8 weeks before I start having calves born that are vaccinated. So I'm going to have to deal with that problem in the interim time. And if I know it's E. coli, I can use a couple of the antibody products that are out there that are not very effective for rotavirus, but they are very good for E. coli in blocking attachment to the gut in that first day of life.
Here's another question came in, and that is homemade recipes. You just don't have anything, a commercial product. Do you have a recipe for a electrolyte that I could use sodium bicarb and beef broth and light salt and stuff like that off the shelf in my kitchen?
I don't. I was working with, I went to Russia and was working with some people over there. We were kind of working on that, and we came up with some rough how many grams of sodium chloride and whatnot, but I don't remember what I told them. If the person wants to email me at gwsmith@ncsu.edu, I'll see if I can work on that.
Or second of all, we can you can send that to Maggie as a question to the readers, and it could be answered in hordes in that block as well. Last question, I promised, just came in. Any comments on apple vinegar to prevent diarrhea?
I haven't seen any data. There's people that swear by it and they think it's the greatest thing since sliced bread, apple cider vinegar. I've certainly heard positive testimonials. I have some dairies that I work with that have used it and like it. I have some other dairies where they didn't seem to think it did much. But as of 2 weeks ago, I did a literature search on it, and I could find nothing published on apple cider vinegar and diarrhea. So I think the concept of lowering the pH, certainly when we have calves on acidified milk, we think we see much less diarrhea than normal. I think if we can acidify the stomach and prevent less of the viruses from making it through, you may see some benefit to that. Obviously, the concept with vinegar is we're going to acidify the stomach and kill some of those viruses. Whether that works consistently or not, I just don't know.
Well, Dr. Geof, you did a yeoman's job here. Just a great webinar, and we appreciate all of the great, quick answers since you had so many questions here. Maggie, we'll turn it back to you to wrap her up.
Yeah, it's my pleasure to do that. Once again, we'd like to thank TechMix for partnering with us and sponsoring this webinar. Their support is greatly appreciated. If you want to learn more about their company, feel free to check them out online. You can find them at texmixglobal.com. We want to say a special thanks to all you listeners as well for tuning in to this great presentation by Dr. Smith. You can see the upcoming webinars right there on the screen for you. August 12th at noon Central Time will the next time you can find us here. We'll be talking housing and cow comfort, and we'd love to see you there. Until then, farewell from all of us here at Hordes Dairyman and the University of Illinois.